Plasticity.
Hi, I'd like to welcome everybody to our monthly live chat with Nurse Linda. And I'd like to tell you a little bit about her. She's been a leader and a provider of rehabilitation nursing for over 30 years and a friend of the Christopher and Dana Reeve Foundation for close to 20. Soon after Christopher was paralyzed, she worked closely with him on his recovery, and it was a special time for her as she had the opportunity to watch him evolve into a uniquely gifted advocate for people living with paralysis. And if you don't know, but she is also our moderator in our Ask a Nurse discussion, which is on our online community. And you can reach out to her and leave questions there that you forgot to ask here. She's in our community every Wednesday from 8 to 9 p.m. Eastern Time, and she answers your spinal cord injury questions and paralysis-related healthcare questions. And you can reach her there at christopherreeve.org/community. But today, it's all about talking live with her. So I want to introduce Linda, and let's get the discussion started. Hey, Linda.
Good morning, Julie, and good morning, everyone. Well, I guess it's afternoon now where I am. The day slips by so quickly, does it not? So this month on the blog, we've been discussing some high-level terms that go along with paralysis and spinal cord injury, and I hope that that's been helpful to people because it's probably one of those things that's not going to affect your everyday routine of life, but it's one of those things that there are words that you're going to be hearing more and more about as all this explosion of research and progress comes in the treatment of spinal cord injury and paralysis. You know, a lot of times people will say to me, why do you focus on an area that affects so few people? And my answer is always the same as why wouldn't you? Because when you're working with spinal cord injury, you're working with an established location, anatomical location in the spinal cord. You usually know if it's from a traumatic injury, you usually know when the injury occurred, if there was a speed involved like in a motor vehicle accident, or if there's a wound, a knife, a bullet, or some kind of trauma that's occurred. You have all these known pieces of information. So if you can isolate the nerves and be able to make those connections and remapping the brain and rejoining those connections, it really gives you a good opportunity to look at individual nerves and how they work together in this very complex nervous system. So once you have that piece of information, you can then translate that same body of knowledge out to people who have paralysis, perhaps from some kind of illness or disease. And you can even take that even further into other kinds of neurological problems, such as brain issues such as stroke, Parkinson's disease, all kinds of different neurological processes. So it's kind of getting down to the elemental level in studying spinal cord injury. So it's very interesting. And I have been working in this field for a number of years, and it's been lucky for me to get the opportunity to do this because of all the gains that have been made, all the research that's been done at this particular point in time, and I've gotten to live through a lot of that, and so that's been wonderful to see all the advances. Now, when you have a spinal cord injury, one day is one day too many, and so it makes it really difficult when you've been living with these injuries for a number of years. And so sometimes people say, oh, yeah, we hear, something's coming, it's right around the corner. But there have been so many progressions, and there will continue to be because this knowledge base in this particular area is exploding right now. So that's why it's important to know some of these words that are going on, things like the central pattern generator, which is, well, for a long time people thought this was a mythical structure in the spine because you can't see it, you can't have an x-ray and find it, you can't have surgery on it. It just is kind of this unidentifiable place in the spine where it's kind of almost like a rudimentary relay system where messages can be conducted kind of automatically, kind of in a reflex mechanism. Scientists speculate that it's probably something that started before in the history of mankind. It's probably something that was in the earliest of humans that didn't have highly developed brains, but they could walk around, and so it was probably due to this pattern generator. So we see it a lot with people who do some of the activity-based therapies, where they get this pattern movement in their legs or in their arms or whatever body part has been affected by the paralysis. If you get the stimulation in there and then you suddenly stop the external stimulation, the movement, electrical current, whatever, eliminate that, but the body will keep going in the pattern of a walking pattern, or moving the arm if you generate movement in the arm through some external forces. So it's a very neat thing to see. Sometimes people will think, I'm kind of concerned about that, because they'll see their legs moving and they'll think, hey, you know, I've got something back here, but it's kind of a reflex stimulus. It's not under control of the brain. So it's a very interesting process. And then that is connected to another word, neuroplasticity. And that is the idea that the nervous system can fix itself and tries to fix itself. Now, when I was in college, it was always the big joke, you know, because don't drink too much beer because you're going to kill off nerve cells. And once you kill off nerve cells, they never come back. They're just gone. Well, that's been a number of years ago since I was in college, but we now know that nerve cells regenerate just like every other cell in the body. It's just a much slower process. So we know that our skin regenerates a lot. We can see if we have a cut on our skin and the skin will heal up. There'll be a scab, and then eventually a scar will form, or maybe you won't even notice anything visible if the cut is not too deep. But you can see your skin heal or regenerate just as time goes by. Well, the same thing happens in your nervous system, but it's much, much slower. So the nervous system is always trying to repair itself. And that's where this term of neuroplasticity comes in. Neuro from the nervous system, and plastic being like, if you think of a piece of plastic, how it can be molded into any kind of shape that is needed. And that's the idea of neuroplasticity, that your nervous system tries to mold itself into repair, into what repairs need to be done. So thinking about those two words, we have a question that's written in here which just fits nicely into this. So thank you, Mavis. That's just a perfect segue, and you didn't even know that that's where I was going. Mavis has written in that she's having some increased spasms and involuntary kicking of her legs. Do I need to see a neurologist, have some more tests done, or is this just normal? Well, 3 questions, yes, yes, and yes. So do you need to see a neurologist? You should probably see some kind of health professional. Whenever there's any kind of change in your usual being, you probably want to see some kind of health professional. It can be your personal physician. It could be a specialist as a neurologist. If you normally see a neurologist for your spinal cord injury, you probably would want to see that person for this issue. I'm not calling it a problem because, ironically, having an increased amount of spasms can be a sign of something maybe pinching or pulling, or some change, something related to the spinal cord injury. But even more importantly is that you could be having more spasms and involuntary kicking because maybe for some reason some messages are getting through that's causing that. So it would be nice to know if these involuntary kicking and the spasms, if it's a consequence of the spinal cord injury, so kind of like a side effect, Is it causing you some challenges, or is it there because you're having some recovery? Sometimes recovery appears as spasms or involuntary movements if messages are getting through that place in the spinal cord where the spinal cord injury is. So you don't have to go and think, oh no, this is going to be more bad news. This could be really good news. On the other hand, if the spasms are becoming painful, or if they become so bad that sometimes people's legs will spasm and they'll actually throw themselves out of the wheelchair because it can become so severe. I was just involved in these last couple of weeks with a patient who had spasms. They were not bothersome, but the patient had gotten a new pair of shoes. So when their legs had spasmed, their feet were rubbing inside the shoes and it caused a pressure sore. So there's a lot of good things about spasms, that it keeps your muscle tone really good. But when they get too bad, sometimes it can become difficult to control. It can cause other further problems down the line. It doesn't necessarily mean that if you have a spasm, you have to go on medication and stop it right now. Spasms can be helpful. They can help with transfers. Some people use their spasms to help transfer, so they use that stiffening of their body to help themselves transfer. And then also it does give you some movement, so it gives you some stimulation in your lower legs, but they can be bothersome too. So it's always a good idea to talk to your doctor. Do you need more tests done? That, of course, would be when your doctor examines your personal case. Again, that's a 50-50 kind of proposition. They might say, well, we need to do some testing to see if there's a nerve that's being pinched, or, just to see what's going on in there. Probably they'll be able to just do an exam in the office and be able to get a pretty good idea of your spasticity. The physician will certainly ask you if the spasms are bothering you or such that it's becoming annoying, or if something's happening that you want to, kind of calm that a little bit, or if it's not really bothering you, you don't necessarily need to do anything about it. There might be some physical adaptations that you can do to your seating, make some arrangements to kind of corral that, so to speak. Or they might also say you need to do some more stretching, because sometimes the muscles are just getting kind of knotted from not being moved so much, and they might tell you need to do some more stretching of your legs, or moving the muscles a little bit to help fatigue the muscles so they're not spasming so much. Muscles go in pairs. There's muscles that push and there are muscles that pull. And so what happens in a spasm is that one of those sets of muscles is more active than the other set. So sometimes you can break the spasm by just doing some stretches on your legs to get the muscles that are pulling too tight, causing the spasms, to get those to relax a little bit. Maybe you don't even need medication. Maybe you just need to do that every now and again. So there's a lot of opportunities here. So is it just normal? Well, again, yes, it certainly can be, but it's a good idea to have it checked to see just, what is going on anytime there's any kind of change in your condition. So that would certainly be one. If you have anything that in your body, like if you develop spasms, if you develop pain, if you have any bleeding somewhere, if you have a pressure sore on your skin, any kind of change can be an important indicator that there might be something else going on. Sometimes there's a problem, and I think you said 2 years. December 14 was your accident. So sometimes people have, it's very rare, and don't jump to this conclusion, but I'm just going to include this for a lot of for a lot of listeners that might be interested in knowing about this. But sometimes there's something that will develop. You're kind of not far enough along in your injury. This probably has nothing to do with you, but just for the rest of the readers, there is a condition called a syrinx, where sometimes you can get a fluid buildup in your area where your spinal cord injury is. So when a person gets a spinal cord injury, you can get a bone fragment that pinches up against your spinal cord. You can have just the nerve stretched, overextended. If you are doing a push-up and you're pressing down on your hand, and sometimes your hand gets bent back a little too far and you're like, oh, that kind of stings a little bit or something, because you've overextended the nerves in your wrist. So sometimes in your spinal cord, those nerves can be stretched too far. And so wherever the spinal cord injury is, what happens, even if the spinal cord injury is to the outer part of the spinal cord, the injury itself will create like a hole in the center of the spinal cord. Even if that's not where the injury is, that's what happens with it. So it's kind of a curious thing. So a little hole gets in the center of your spinal cord. So if you would look through your spinal cord like a loaf of bread, if you could take slices like through the MRI scanner and how they'll take different segments, it will show you that right in the center of your spinal cord where the injury is, there's a little hole right in the center. So the nerves aren't going through there. There's scar tissue. There's some goop that collects in there. And this will get sealed off in your spinal cord. There'll be a little coating that almost like the outside of a cyst. And that's why nerves can't get through that coating. And that's what they call the little scar in there. And so sometimes that goop or that fluid that gets inside the center of that donut hole will start expanding, and it'll start filling up, and that will start pinching off the other nerves around the donut. And so when that happens, you need to have medical attention. Now, clearly, Mavis, this is not your case. You don't describe those symptoms. But I only say that because sometimes people later in their injury maybe will have some change in their function, or they might have some change in developing spasms or something like this, and they need to have an X-ray to check for a syrinx. That probably is not your case since your injury is only 2 years old. It's a very rare thing that happens just in general, but at 2 years it would be even more rare for you to have that. So don't worry about that. But whenever there's a change in your condition, it's always a good idea to see what's going on. So how often should you see a doctor specializing in your injury? Usually what we say is 1 time a year. You should see your spinal cord injury specialist. Now, different places work different ways. So sometimes you might be connected with a doctor that's a spinal cord injury specialist, and that is all they're treating is the spinal cord injury. If you get a cold, or if you get a UTI, or you have some other kind of problem, they'll want you to go see your primary care physician for that. Now, other spinal cord injury doctors will treat the spinal cord injury and then all the complications that go along with that. So a spinal cord injury specialist might treat your spinal cord injury and your UTI. But if you have other kind of general problems, you just need your yearly checkup, or you need, I don't know, medication for flu or colds or something, then they might say go to your primary care doctor for that sort of thing. And then there are other spinal cord injury specialist doctors that just treat everything. You just see them and they're your primary care doctor. Some for females will do female health, some won't. So you really have to work with your doctor to know what they're going to treat, what they're not going to treat. You can always call their office, explain what the problem is, and then they'll be able to guide you, because sometimes it can get kind of confusing. But mostly they will, tell you up front, this is when you come see me and this is when you go see somebody else. But for a specialist, we would say 1 time a year. There are some other things that you should do one time a year. You should probably have urodynamic testing, and that would be done through the urologist. Here again, some spinal cord injury specialists do the urodynamic testing right in their office. Some do not. Most of them will send you to a urologist for that. You would also want to have your bones checked for bone mineral density. And so you would want to see that is usually done in a separate office. But the spinal cord injury specialist should coordinate all this for you. You know, it's time to have this done. It's time to have that done. You want to get a flu shot every year because you have, with a spinal cord injury, you have a decreased immune system. And so you want to be sure and get your flu shot if you're able to take that. You want to get the pneumococcal shots if you that's for respiratory problems, so the pneumonia shots. Those usually come every 10 years. And now we also have the shingle shot. So you want to check with your doctor depending on what the cause of your spinal cord injury, if you should have the shingle shot or not. So lots of decisions to be made, but those are just the routine tests that should be done every year. If you're a higher level, you might need a pulmonary function test to be done yearly to see how that is going along with your breathing. That one, it doesn't hurt for everybody to have those because no matter what the level of your spinal cord injury, you'll have some impact on your breathing. Even if you have a very low level injury, abdominal muscles affect your breathing also. And so if you have weak abdominals, that can affect. But there again, that's based on you and your condition between you and the physician that you're seeing, because if you usually have a lower level injury, you usually don't get the pulmonary function test. Those usually go with the higher level injuries. So again, you might have some special circumstances where you need to follow that more carefully, and then other people are just like, no, I have a paraplegic injury and I don't need that. So, you know, what's she talking about? More tests. So, you know, it's really unique to you, but you should see your specialist at least once a year. Sometimes you might be seeing a specialist. You see them for a few years. They say, you know, your primary care doctor is doing an excellent job treating your spinal cord injury, so just come back to see me when you have an issue. So there's all different kinds of arrangements that are made for people who have spinal cord injury. Some people don't have access to a spinal cord specialist and they see a neurologist, or their primary care physician is their person in charge. So just be sure and work that out with your physician, but you should see a doctor at least one time a year. Okay, so that was a lot of words for that. See your doctor once a year. Okay, let me see here. I kind of lost my place in the question here. So, okay, here's a person that keeps getting UTIs, and what's the best way to prevent them, what to take or what not to take. Well, you know, this is the thing, Robert. UTIs are just so prevalent, and it seems to me like some people can just go out and do anything with their catheterization anyway, and they just seem to have a lot of resistance. And then other people just seem to, you know, like look across the street and they've got a UTI. So a lot of it has to do with your own internal immune system. And so you want to keep that healthy. So there again, you want to keep your whole body healthy. But there's been a lot of work in UTIs, and the very best thing that you can do to prevent an infection, UTI, cough, cold, any kind of flu, any kind of infection, is to wash your hands with warm, soapy water. And then while you wash your hands, you want to rub your hands together, creating friction with the warm water and the soap. And hold your hands so that the water runs from your wrists down to your fingertips. And then wash your hands for the amount of time that it takes to say the ABCs, for the amount of time it takes to sing happy birthday. So you just don't want to go in and run your fingers under the water and say, oh, there, my hands are washed. You want to spend a little bit of time there washing your hands. Be sure and wash your hands before you catheterize as well as after you catheterize. Before you clean, be sure you clean yourself before you catheterize. So, take a good look at your technique just as far as your hands go. Now, there's a lot of there's a lot of issues that go around. Should I be using clean technique? Should I be using sterile technique? You can get upgraded if usually your payer will upgrade your catheters to a new catheter every single time you catheterize. That's pretty much the standard now. There are some people who have the old red rubber catheters that they boil in between use, and that's been demonstrated to be very safe and effective. But if you're getting a lot of UTIs, you can talk to your doctor and they can talk to your payer about maybe getting a upgrade in your catheters so that you can use maybe like the self-contained catheters that you never even touch the catheter. There's such a variety of catheters on the market. You can get the pre-lubricated catheters. You can get one with hydrophilic lubrication so that, it could be an issue with lubrication. So you really want to look at how you're performing your catheter. Are you using plenty of lubricant? Because if there's a little friction when you're putting the catheter in, which you will not be able to sense, you will not feel it while you're putting the catheter in, but sometimes you can get little tiny cuts along the urethra from trauma, and so you want to be sure to lubricate well. You don't want to take if you have lubricant in a tube, so you're using it multiple uses, you don't want the tube tip to touch anything. You want the lubricant to drop onto the catheter because that keeps the lubricant sterile inside the tube itself. So those are some mechanical kinds of things that you can do. Some other kinds of things that you can do is to look at what you're putting in is what's going to come out. So look at those kind of things. The sugary drinks, sodas. Sometimes people will drink a lot of juice. That puts a lot of sugar into your system. And people who drink a lot of sugar tend to have a lot more UTIs, spinal cord injury or not. So look at the quality of the fluid that you're drinking. Keep yourself flushed. Another thing people don't want to do is drink because when they drink, they're going to have to catheterize. And so you don't have to sit down and just drink, gallons of water all at one time, but drink continuously throughout the day so that you're keeping your system flushed. Another thing that you can do is to keep moving, and this is something that has come out of the activity-based therapies. So in working with these, I would see people performing the activity-based therapies in the therapy gym. And just through observation, not through scientific process, but just being a nurse through observation, I would notice that those people would have less infection. And so people, why would that be? Well, a lot of people think, well, they're, really into activity-based and they're really gung-ho and they're just taking good care of themselves because they're so in tune to what's going on. And I think, not really. I see people that are doing activity-based that are doing it, but they really don't have that level of internal intensity attached to it. They're doing it, but not, no, that's not self-motivation. That wasn't it. So we went into the lab and we looked at animals that did activity-based therapy and those that didn't. And it seems that moving around keeps that bladder kind of shaken in there. And if you're moving around, if you're walking, or if you're even just moving your legs, doing some exercise, doing range of motion a couple of times a day, that stirs up the urine in your bladder. And if the bladder's kind of sloshing around in there, bacteria doesn't have time to stick up against the bladder wall and start collecting there. So it seems like the more movement you have, there's also been separate from spinal cord injury, there's also been some evidence about movement helps men with prostate trouble, because just the movement around in the legs and the abdomen, that seems to help with that too. So that's kind of just a sidebar little piece of information. But when I read that, I'm like, aha, there's another little piece of information about movement. So movement is very important. So keeping your hands wash and clean before you do your catheterization and after. Looking at your technique of your catheterization, making sure you're not, setting the catheter down or touching the catheter to your skin before you put it in the urethra. Looking at your fluids that you're taking in, water being the best just to keep things flushed, and then actually taking the water in. Yes, you're going to have to catheterize, but everybody has to go to the bathroom. So just looking at those kind of things, and those are really the best way to prevent. Now, there are some theories about different medications that you can take. Some people in the past and even currently, some people will be on low-dose medication, particularly some low-dose antibiotics, continually. Now, if that's the right thing for you and your doctor, then think about it. It's not really done a lot because there's so much resistance to antibiotics now. You don't want to get into that chronic regimen. If you do all the other steps, you should be able to be fine. If you're developing more and more UTIs and you have evidence of documented UTIs, your healthcare professional can talk to your insurance company about upgrading you to a higher level, more sterile catheterization system. And again, there's so many different kinds of catheters now. So, that's always a possibility too. But even if you use a completely enclosed self-contained catheterization system for intermittent catheterization, you still need to wash your hands before you do it, or your attendant needs to wash their hands and wash the urethra before you catheterize. So that's just something we're not going to be able to get away with. That's probably the biggest thing, is always washing your hands. Here's somebody who's participated in a neuroplasticity study, and it worked. And so I'm not sure what exactly that study was or how that was set up, but it seemed to work for this person. So we need a little more detail about that particular study. But she's also reading about studies for conductivity for pain and use. So there are a lot of studies where they're trying to use different stimulations to make those connections through the spinal cord injury or the site where the injury is. Now, we call it spinal cord injury, SCI, that's what we call it, but it could be from trauma or it can be from disease. So if you have an injury, a spinal cord injury, it can be from either one. So I know sometimes readers will say to me, everything seems to be geared for trauma, and I think it's because we use the term spinal cord injury so that people think of trauma, but when we say spinal cord injury, we mean from either one, spinal cord injury, illness, or disability. So know that those are all kinds of interchangeable. So there are implant studies. Yes, the big one going on right now through the Christopher and Dana Reeve Paralysis Foundation is called The Big Idea, where they're putting electrical implants in the area of the spinal cord injury to make those connections leap across. And they've done it with a small number of people, and now they're doing it with a larger number of people trying this out. And it's in my opinion, it's been very successful in the small number of people. The results have not been released in this next level of study that I'm aware of. But in my opinion, it's very successful. Now, does that mean that people get this implant and they just pop up out of the chair and walk around like they used to before their injury? No, but it means that they've made huge leaps of improvement. It's not a quick fix. It's not like just, well, we do the surgery and now you're all better. It's the idea that it makes some connections. It's a starting point. It's a place where people have demonstrated movement that they did not have before. And then there's a lot of therapy that goes along with it to kind of help the brain relearn and retrain how to do all these things. So as I say, it's an interesting time for spinal cord injury research. So that is one thing. There's also some implants that people are using that deliver medication directly to this bathe the outside of the spinal cord. So you can get a lot more medication for pain or for spasticity if you have that implant that will directly bathe the spinal cord, because the medicine doesn't have to go through your, when you take a pill, it goes down to your stomach, it gets absorbed in your organs and goes through your gut, so it goes through your whole body, and it's sometimes taking a lot of medication is just too hard on your stomach and your gut, and so this can deliver a lot more medication. So they're kind of two separate things. There are implants for function, there are implants for pain. I don't think there's any implants that do both right now, but that doesn't mean that there won't be coming up at some point in time, and maybe there'll be some connection between the two. But yes, there's an awful lot of studies that are going on out there. It's kind of hard to find studies when you're out living in the community. Many of these spinal cord injury specialty studies are done in specialty facilities, and not everyone has the access to go to those. You can go to the NIH webpage, and you can look up, I'm just thinking of the website. You can go to the NIH website, nih.gov, and they will have a button there, a link to current studies, and you can type in spinal cord injury, or if you have a particular kind of spinal cord injury disease, and you can see what studies are going on around the United States. Now, most often people have to live nearby a center where the study is actually being conducted, so you could live by a center where a spinal cord injury center, but maybe you don't live by the center that's doing the study that you want to participate in. And that can get kind of frustrating too, because you have to be able to go to follow-up appointments, and you have to be able to travel to get there, and you have to participate in the therapy. So there's a lot of different elements that go with that. But as studies get to be, as they get higher in the study process, they're offered in more and more sites. So it's a good idea to just know what's going on. And any kind of government-funded study, anybody who gets money from the government to do even a little piece of the study will have their study posted there. And they'll have a layman's term section, so they have a section there where you don't have to read all the science and understand all of that, but they'll have a bit there that will tell you just exactly in normal speech what that study is all about. So keep up with those kind of things, because sometimes you can find out about a different therapy or something that's going on that you can talk to your therapist or your doctor and say, can we can't do this study, I can't be in a part of this study, but it seems like there's a positive outcome with this particular therapy. And sometimes they can take part of it or pieces of it that's already been accepted by the government and kind of get you started on that. So, for me, I think of the activity-based studies, which are clinical studies, but the activity-based therapies are not studied. They're available to you now. So if you find a study and you think, hey, aquatic therapy, that seems to be maybe what I might need, you can talk to your doctor about that and maybe get hooked up with some aquatic therapy. You wouldn't be in a study, but you could see if those different elements work for you. So the research studies that are funded in the government go by 4 phases. Phase 1 studies are really for safety. A lot of people will get involved with Phase 1 studies because they think, oh, well, they're really heading for a cure here, and they just don't want to say it yet. But no, Phase 1 is only for safety. That's the first study that's being done, and they're very small numbers. So what it is they've discovered something in the lab. Somebody's made an observation as they're providing treatments for their patients, and they want to do a study of that. So they'll pick just a small number, and it could be as little as 1 person, or it could be like maybe 6 or 10 or 12, very, very small numbers. And what they'll do is they'll try the particular therapy, medication, treatment, whatever it is that they're testing. They'll try with people, and then literally these studies are just to see if it's safe. There's nothing to do with, they're not expecting any outcome. They're not expecting anything to happen. People will think, yeah, but it probably will. No, they're not even testing for that. So it's just to see if that particular treatment is safe in human beings. So those people in Phase 1 studies are pretty brave people. Okay, and then Phase 2 studies are, they know that now it's safe, so now they'll start looking at the dosing. So medication, is 10 milligrams enough? Should we give 20 milligrams? So they start looking at what the dosing might be. If it's a therapy treatment, do you need 10 treatments or do you need 100 treatments? Do you need it an hour a week or do you need to do 40 hours a week? So they're really looking at dosing kinds of things. Then in Phase 3, they've kind of figured out the dosing, so they'll start honing it and refining it. And then Phase 4 studies are when they're just getting ready to release and go to market. That doesn't mean that they're, all set and all finished, but if you look at those phases, you can kind of tell where things are in the process. So that kind of helps you a little bit with those studies. But if you go to NIH.gov and look up studies, you'll see what's going on and around, and it's very interesting. You want to be very careful about looking at studies outside the country. People have this love-hate relationship with the FDA, the people that monitor the drug studies. Because in the United States it is very strict. It is very strict because they really don't want anything bad to happen to people, so they're very particularly strict. In other countries they do different studies. In some countries there's no governing of the studies at all. A researcher wants to do a study, they do a study, and that's all there is to it. And so there's nobody kind of monitoring, like, is this reasonable? Might this do more harm than good? What about other side effects? And so that's the FDA is there for your protection. It does make things slower, and that can be very annoying. But in the bigger picture, it keeps people pretty safe. So that's an important thing to know about. Studies that are government regulated will be free to you. There is never a fee for you to participate in a study that's supported by the government here in the United States. Now, other countries will say there's a lot of advertisements. Come to this country and we'll do this study, and they'll have people you can talk to, and they'll say, yes, it worked wonders for me, and I now walk and I do everything. And if you have to pay money for a study, you're probably just paying money to somebody. Lots of exposés are done on 60 Minutes for these kind of things. So anyway, be very cautious about that. You should not be paying to participate in a study. Okay, we're going to skip over here a little bit, and there's a question that's really important here. Are people who have a spinal injury at higher risk for dangerous side effects like Guillain-Barré from a flu shot? Well, if you have Guillain-Barré, it is can be a side effect of some of the flu shots. You know, back when President Ford was president, when Gerald Ford was president, flu shots were just, they were around. A lot of people weren't getting them. They seemed like they were very important. And so I remember very famously he was on TV and he took his flu shot and urged everyone else to get it. And that particular flu shot had a lot of side effects, and people ended up getting Guillain-Barré. It was for the swine flu, I think it was, and it was really a bad flu that was going around. And some people had hearing injuries and all kinds of side effects from the flu shot. Now, because of that, that particular point in time, they're much more careful with the flu shots, and there's a lot more testing that's done to try to make them safe. If you have Guillain-Barré, you're probably exempt from taking the flu shot. Again, it's going to be up to you and your physician directly to talk about what is right for you in particular. Most people with Guillain-Barré do not take the flu shot. It's not advised. That doesn't mean that for somebody out there who's had Guillain-Barré that they cannot have the flu shot. You know, there will be somebody who maybe had a case of it, maybe they weren't quite sure, maybe the diagnosis was never really made. But anyway, that usually affects that. So if you have a spinal cord injury but you do not have Guillain-Barré, you can still have the flu shot. Again, it's a one-on-one decision made with your physician depending on what the source of your spinal cord injury is. If it's a medical cause, there might be some prevention from going ahead and having the flu shot. But are you exempt? Can you not have the flu shot because you've had a spinal cord injury? No, especially if you've had it from trauma. Because you know that it's a different etiology, it's a different source of your spinal cord injury. Guillain-Barré is an autoimmune disease, what they call an autoimmune disease. So your immune system is kind of is gone crazy, and instead of fighting bacteria or some kind of infection from the outside world, a virus or infection from the outside world, the autoimmune disease is when your body starts reacting to your own body. And so that's what is the source of that. And that's why Guillain-Barré it's been connected with the flu shots from way back when. And it's an autoimmune disease. So sometimes if people have autoimmune disease and that's caused their spinal cord injury, they'll say no flu shot because they don't want to reactivate that autoimmune disease. So that's why. So Guillain-Barré is a spinal cord injury disease, but it's from an autoimmune source as opposed to trauma or something else. So that's why that is like that, is that way. That's the connection between the flu shot and autoimmune. So let's see. The heat and humidity most definitely affects people with spinal cord injury because of the difficulty controlling body temperature. It has to do with effects in the cardiovascular system. It's harder to control your body temperature, especially below the level of the spinal cord injury. Your body might not react to feeling heat. It might not react to feeling cold. I see a lot of people here in the Midwest. I'll see people with spinal cord injury and it'll be freezing cold outside, there's snow and ice on the ground, and they have no shoes and socks on. And, I'll be like, why don't you have shoes and socks on? Well, I don't feel it, so it's not bothering me. Well, your body still reacts to that. And so especially in the cold, you need to have your feet covered. And in the heat, you need to have your body in a comfortable temperature in the environment, because that's the temperature that your body will be sensing. So heat and humidity especially can be cumulative in the body. So you want to maintain an environmental body temperature that will be most comfortable for your body. Certainly people want to go outside and enjoy summer activities, but thinking about summer activities, I was just in San Diego, and it was 100 degrees in the shade. I think it was about 110. Just walking around in the sunshine, it was extremely, extremely warm. And so a lot of people were just getting sick just because it was just too hot. And they were doing strenuous kind of activities, and even just walking around can be difficult. So even rolling around in your chair, the heat can build up in your body. So be very careful in this heat and humidity type of time. So just be very careful in this warm weather. If you have a spritz of water to cool off, drink lots of cold water, sit in the shade, don't overexert. These are things for people with spinal cord injury, but they're also things for people who are older, young babies. You shouldn't really have them out in the sweltering heat because it's so hard for them to regulate their body temperature also. This is a very good question that somebody's written in. How can I increase my neuroplasticity on my own? Wow, what a fantastic question. And I think probably the best way to increase neuroplasticity is through movement. So the more you can move your body parts, the more feedback you're giving to your body. So think about where your spinal cord injury is, and then people might not have sensation or movement below the level of that spinal cord injury. But your body still works below there. It's not working because it's not getting the message from your brain through that spinal cord injury place, and it's not getting the feedback from your body below the level of spinal cord injury back up to your brain, because there's this interruption there in your spinal cord injury. So you can increase your neuroplasticity every time you do range of motion, every time you move your body, if you have any kind of exercise cycle. If you're just standing in a standing frame, you're increasing your neuroplasticity because your body below the level of spinal cord injuries is providing feedback. Now, if you keep providing that feedback to go up to your brain, and if you think about you're on the bicycle and you're moving your legs, you're doing range of motion on your legs, think about your ankle moving when you're doing your range of motion. Think about your knee bending when you're doing your range of motion to your knee. Think about your hips moving. Not only are you going to be sloshing, remember we were talking about sloshing that urine around in the bladder, so you're going to be doing that. You're going to be moving those muscles. They're still interacting together. You might not feel it. You might not know it's happening, but every time you move your extremity, you're moving, your muscles are still moving in unison. So when you move your leg and do your range of motion, you're providing feedback into your abdomen, so you're really stimulating your bowels and you're helping your bowel program. So when you think about it, so visualize it in your head, think about it, make your brain think about, I'm moving my foot. Make your foot move while you're doing your range of motion, or if you're doing any kind of exercise, moving your body parts, you are creating neuroplasticity. You're trying to get messages, and eventually the body is going to try to reorganize that nervous system, and it's going to try to get some message through. So one of the things, Christopher Reeve was severely injured. He had a high-level injury. High enough that he had to have mechanical ventilation for breathing. So he had sensation. If you think about, you have a T-shirt on, and where the neck of that T-shirt is, that's where he had no sensation from there down. So he had to have mechanical ventilation, but he had a lot of movement. And even before he started into the activity-based therapies, he had people ranging him every day. And so one day, just out of the blue, he could move a finger. Not with any purpose, but he could control it. And it was just tiny, tiny, tiny little movement. But that was his first connection. And then once that little movement got there, he had broken through that barrier, and he had this little movement in his finger. Then he started this activity-based therapy, which is really a huge commitment in time and effort. And, you're giving up a lot to do as much therapy every single day that he was doing. But he was doing it, and I've seen other people that, are religiously doing their exercise and their activity, and they're still waiting. And my heart my heart just aches for them because they're just doing everything. Some people get it sooner, some people get it later, some people don't get it until way later, so it can become very, very frustrating. Some people are still waiting, and when it will come, there's no rhyme or reason to it, but the more I think that you provide input to your body and the more that you think about moving, just visualization and thinking about, when you get up in the morning or when you lay down at night, think about, I'm moving my big toe, I'm moving all my toes, I'm moving my foot, I'm moving my ankle. Think about going through each body part and moving it, because at the most oddest time, something just might move. And I think that sometimes people don't do these things because they're told, well, that's it, you've got a spinal cord injury, so that it's not going to happen. But it can happen. It's happened to other people, and it can happen to you too. Now, if only we knew why or when, if I knew, I would tell everybody the secret. Here it is. And so we don't know all the pieces of the puzzle yet, but we do know that if you do these certain things, that you've greatly increased your chances of having some kind of recovery. Some people will do nothing and they'll have some natural recovery because your body wants to recover, it wants to do this. So let's just put our bodies in the best condition that we possibly can by trying to increase our neuroplasticity, moving as much as we can, thinking about moving, and just engaging in our bodies. Sometimes people will have some movement, but it's just kind of difficult. It's difficult to try to work against gravity, and it's just so very hard, so it's just easier. So anything that you can do for yourself, you want to try to do for yourself within reason. Some people have high-level injuries, and they can put their shirt on, but maybe it'll take 2 hours. Well, maybe that's not the best use of your 2 hours. Maybe 2 hours of therapy would be, better if it's possible. So think about all those things that you can do to help yourself. And then there's still some more questions on here. Unfortunately, we've come to the end of our session here, but think about if you have any more questions, we can answer them next month, or you can write in onto the blog, because we're all about the questions, and there's been some great questions today. So I appreciate everybody's understanding and patience, and we'll keep moving. We'll make that our goal this month, is keep moving. So Julie, I'll turn it back over to you, and I thank everyone for joining us today.
Thank you, Linda. You may now get a drink of water. So thank you, everybody, for joining us this month for our live chat with Nurse Linda. What a great resource she is. And I want to remind everybody that they can go to ChristopherReeve.org, click on Ask Us Anything, and you'll be able to reach out to one of our paralysis information specialists. They're live people willing to talk to you. So please take advantage of this free resource that the Christopher and Dana Reeve Foundation has for you. So thank you all for coming, and I'll see you next month. Bye.
Bye-bye.